Hi everybody, this is Ahmed Al-Ghoul, corneal surgeon based out of Calgary, Alberta. Today I'm going to talk to you about what I do on a day of eye surgery and how I actually prepare for it. Okay, so it all starts with obviously a good night's sleep because you're about to do eye surgery on people. So you have to make sure that you're comfortable, you slept well, you ate well, and you're about to come and do good work. So that's the first thing you got to do. The second thing you got to do is you got to make sure beforehand that everything is in place from a point of view of the staff, having the right nursing personnel in place, making sure the laser systems are all working. So it's kind of like having a pilot, who gets in an airplane. Before you get in the airplane, you know you guys are waiting to get on the airplane. The pilot is checking all these different things, making sure that they're all kind of working properly on the airplane. Well, the same thing. We're having debriefing with our team in the morning, making sure that the laser systems are up and running perfectly. We have our nursing team assigned for the recovery area, the nursing team assigned in the operating room, our staff in the front reception area, make sure everybody's on the top game. Because obviously when you're about to have laser eye surgery, you're going to be nervous, right? So we're going to make sure that we are definitely there to smooth in the ride as much as possible. So we always say, we're only as good as the first person who says hello and the last that says goodbye. So that means that everybody's going to be on their A game. And really, I can't do it all by myself. So that's why I'm so blessed to have an awesome team where I work who really understand that message. So once we got basically the everybody's mental mindset to come in for surgery and the health, once we have the team in place, once we know the laser system is in place, then obviously we're going to start the process of getting our patients through the laser experience. And it's really important that obviously we check their vitals, make sure they're healthy, make sure that that their anxiety is alleviated with any questions they may have with me. And that's why we spend the time beforehand to try to answer the questions. I also always emphasize that we should check their vision again. I know that we've done it like 6 times already. We have all the measurements, we've already documented it, we've already inputted in the system, but it really helps that the refraction or the measurements of the person's refractive error or the vision is checked one more time. I find a lot of patients find that really alleviating to them, to make sure that the doctor got it right. And so we're really just trying to make sure that they're as comfortable as possible in that process. So once we go through that process, we then take him to the operating room, and then we're going through safety checks. Some of it internally in my mind, some of it with my nursing team, some of it actually with my patient. So let me explain that a bit. So with the patient, obviously we go through asking them questions like who you are, even though I know I just said hello and I know them, but we still go through that. We go through the allergies, we go through the date of birth to make sure again that there's no mess ups here happening. So once we go through that, then again, we're doing our own internal checks on the system to make sure that everything is going really well. The laser system is already in place. Obviously, we've done that before, but while the patient's in the room, we got to make sure again that's actually going according to plan, right? It's kind of like being a pilot, right? You got to make sure that all the checks are in place, right? So this is part of the process. Even though your passengers are in the airplane, you're still kind of checking yet again a few more things. So once we do that, then we go through our own checklist out loud with our team in front of our patient to, again, give them that certain sense of confidence, but also assurance on everybody that's in the room that this is the patient, this is the refractive error that I just measured, and this is the treatment that we're going to be doing. And again, just yet an extra boost of confidence and comfort for everybody in the room. So again, once that's done, those are really all the checks. There's almost like 3 different safety checks that we're doing, right? With the patient, internally make sure the laser system is working, and then externally with everybody being on the same page about what we're correcting. And then the rest of it is sort of like being a pilot, really. It's literally like me holding the patient, going through this journey of corrective eye surgery, and kind of making sure at the end that it's all done and they're safely leaving this whole experience with the right outcome. And so that process entails me looking at multiple things, looking at their eyes, looking through the loops, looking at the screen, making sure that everything is going perfectly aligned, And then, of course, I'm holding their head in that process too to make sure that they're, again, in alignment. Now, the beauty of the new systems like we have, for example, there's so many tracking, so many tracking systems in the lasers that it's almost impossible. I wouldn't say zero, but I would say almost impossible that the laser would fire erroneously. But I'm there to make sure that doesn't happen. So that's the surgeon side, right? But of course, you're also watching to make sure that the various alerts in the laser are actually going according to plan. There's certain noises, if you will, or auditory cues that tells you that things are going according to plan. And if they're not, we would be adjusting things. Again, incredibly rare, but this is where expertise comes in. This is where experience comes in, where you can make sure that you just smoothen that experience, make sure nothing is out of the ordinary in that process. And then once that's done, then and the laser is done, for example, then you're taking out the apparatus that you're putting on the eye initially to let that experience go through smoothly. And then I'm taking the patient back to the recovery room, and I'm sitting down and I'm talking to them about all the things that I would be worried about. So a big thing, of course, is comfort, right? So I want to make sure that they're well stocked on any medication they need. So I go through that with them. I actually go with every single medication that they have. And I answer the questions about sort of any concerns they have about the order of the medications. And then we want to make sure also that they know what to do, right? So if it's, in the middle of the night, they're wondering what drops to take if they're feeling certain discomfort, I go through that with them to make sure, again, that they feel that sense of comfort and confidence that they're not left alone. And of course, I give them my number anyway, so they're calling me if there's any issues. But of course, that whole day is basically dedicated for my patient from morning till end, and even the next day, right? Because I'm in alert mode just to make sure that if something comes up, if there's any concerns that the patient has, I'm available for them. And that's what it takes to really deliver that kind of care that you want, to make sure that that experience, that journey is truly flawless, or as close to that as possible, that you hope to deliver. And then, of course, the next day, I'm seeing the patient to make sure that everything that I've done the day before went according to plan, and making sure that the next part of the process, which is the recovery, is on track and is on par with the rest of my team, the rest of my doctors, and with myself, and ensure at the end of the day, of course, that they get the outcome that we're hoping to deliver. So I hope that was helpful in the sense that we wanted to give you a bit of sense of that it's not just me pressing on the foot pedal, and it's not just me taking the patient in the room and just kind of going away at it. There's a lot of things that go in my mind that make sure that indeed we're delivering the best care for our patients, to truly deliver a no compromise philosophy, which I really think is what every eye surgeon should be doing for their patients. That's it for me today. I hope you found that video enjoyable. Thank you for watching.